It's 12 now.
Please stop presenting. Dr. Juri Priya Brahma, please stop presenting. Please stop presenting. Dr. Juri Priya Brahma, please stop presenting. I have removed this participant.
Who?
In spite of repeated requests, they don't stop presenting. That's why I removed them.
Yes. Correct.
Okay.
Maybe you say to rejoin after.
Now we are live on Facebook and it's time. Dr. Galdhar, you may start, please.
Yeah. Good morning, everybody. Today is the big day for Indian Society for Veterinary Medicine. We are starting webinars on behalf of ISVM family. I request Dr. Nilesh to start out the presidential address. Dr. Nilesh, please. Dr. Nilesh, please.
Yes, sir. I'm starting.
Presidential address. Yeah, please.
Is it seen? Presidential address.
Because this lady again.
That Juri is again presenting. You remove her.
I think probably she doesn't know that she is on the screen.
Yes. Please remove her. Ask her to come to Facebook.
I have removed. I am now presenting the presidential address.
Please.
Is it seen?
Yes.
Hi, participants. Hope you and your loved ones are safe and healthy during this difficult time that our country and most of our countries are facing as the aftermath of COVID-19. It's a matter of pleasure that the Indian Society for Veterinary Medicine is starting ISVM webinar series 2020, which will have lectures by eminent teachers, scientists on a variety of topics, mostly related to veterinary medicine and their implications, if any, on public health. We are in the process of acquiring webinar license for ISVM, and once it's done, hopefully in a week's time, we will be able to accommodate much large number of participants. Those who are not able to join on the webinar portal can participate in webinars through ISVM page. I'm sure the lecture to be delivered under the webinar series will enrich the information of the participants with regard to the topics covered by experts. Hope to get your comments, feedback, and also the suggestions regarding the lecture and the webinar. Please take care of yourself and your loved ones. Jai Hind. Dr. Nauriyal. Thank you very much. Have a great day.
Thank you, Presidential, sir. Dr. Nilesh, shall I
It's
introduce Samad,
on,
sir?
yeah, sir.
Yeah. Yes, sir. I'm introducing to Professor Samad. I find very fortunate to introduce Dr. Samad, sir. Professor Dr. Samad is a renowned teacher, researcher, and administrator. In his professional career, Dr. Samad worked as Associate Dean, Mumbai Veterinary College, and Dean and Director of Instruction, Maharashtra Animal and Fishery Sciences University, Nagpur. He established Asia's first veterinary nuclear medicine center exclusively for animals and developed nanoparticulate drug delivery system enabled formulation for veterinary use. Today, on behalf of ISVM, we invite Dr. Samad to deliver webinar on corona-associated respiratory and enteric syndrome in domestic animal, lesson for public health. I request Samad sir to start his seminar. Thank you very much.
Thank you, Dr. Galdhar. Thanks for this introduction. Good afternoon, all the participants. I'll start my presentation.
Just share presentation.
Yeah, I'm sharing the presentation.
Yes, sir.
I hope everybody can see the screen now.
Yes, sir, it is visible.
Okay, so no, you can mute yourself, Galdhar.
Yes, sir.
Okay. Now today I'm going to touch upon coronavirus associated infections in cattle, but we'll also cover other relevant topics because this COVID pandemic is also giving us an opportunity to look at the various aspects of epidemics and pandemics even in animals. So what I'll try to do is also do lateral issues related with coronavirus. As you all know, coronavirus is a very big family of viruses. It must have evolved very long time back from a common virus, and then it kept on changing itself. So we have a large number of different types of viruses which are classified into the corona group. These viruses are present in many species of animals. So probably it's there in almost all the animal kingdom in some form or the other form. In some animals it may not produce any disease but will remain dormant, whereas in other animal species or in human it can become pathogenic. It also causes variety of diseases. The same virus can also lead to number of syndromes, and depending upon the antigenic diversity, you can find even within the population different types of viruses. For example, now in India now it's said that there are 3 different types of viruses that are circulating, and each one is having a different RO or not, generally what is called as, and that is the reason in some areas it is spreading very fast, in some areas it's not spreading that fast. Generally the notation for coronavirus is like if it is bovine, so we say BCOV, so it becomes bovine coronavirus. If it is mouse, then it will be M. So similarly that type. Whereas for human, there is a different kind of notations they have evolved, like SARS or some other notations. So this bovine coronavirus belongs to genus beta coronavirus, and this virus is very similar to human coronavirus, HCOV-OC43. And then this HCOV-OC43 is also very closely related to other pathogens like SARS-CoV and MERS-CoV. SARS-CoV was the one which was seen in Far East sometimes back in 2004, 2006. Whereas MERS is a pandemic which was seen in Middle East. So these are all very closely related viruses, which tells us that probably they have been evolving over a time, from the common parents or common virus. Broadly speaking, from the point of view of epidemiology, there are different classifications, like taxonomy classifications are different, but from the epidemiology point of view, we can group these viruses into two broad groups. There is one group which keeps on multiplying, because these are the viruses which can infect multiple hosts, and in each host they keep on mixing. So because this is the typical nature of the RNA, because RNA viruses cannot multiply by themselves, they have to depend on the genetic machinery of the host. So what they will do, they will insert their genome into the genetic machinery of the host, and somewhere there are some errors which in normal course other cells would be able to correct. But since these RNA do not have capacity to overcome the errors or do corrections in the errors of replications, there is a kind of what's called mutation, and because of mutation you keep on having different species of different genotypes of viruses. So this is one group, and we know avian influenza, like viruses where a large number of viruses keep on coming into birds, and it usually jumps the species, the other lower species, and then comes to the higher species. Whereas bovine coronavirus is supposed to be quite stable from the point of view of genotype, and there are very little nucleotide changes which are taking place, because of which there is also very little of amino acid and protein sequence differences. So you'll find, although there are, there are some strains even in bovine coronavirus, but there is a lot of nucleotide as well as amino acid homogeneity. So we say stable viruses and the one which are not stable. So probably the stable one are the one which have evolved earlier, so that on the tree of evolution, after a very long time they have become stable, whereas other viruses are probably still evolving. So they are trying to find out what is the best mix for their survival. We must remember that as we have instinct of survival, the viruses and bacteria also have instinct of survival. And therefore, as we adopt our strategies of survivability, they also have their own their own methods of becoming to survive within the host. So that is how this fight goes on. And since the viruses and bacteria are very simple and not complex like human and mammals, so therefore for them changing themselves to situation becomes very easy, whereas for human it's quite difficult. So this is one of the corona photographs I have shown. The earlier one, which we have seen, has become so common that on TV nowadays you don't find heroes and heroines, but you do find that photograph of the coronavirus where its envelope protein are like crown. So now bovine coronavirus causes similar disease in other ways. So even though it is quite stable virus and the genotype is same, but it can infect a lot of other species of animals. So it's not specific to only cattle. You'll find this BCOV even in other species of animals, and it may also cause disease in those animals. For example, it has been isolated from dogs, turkeys, camel, wildlife, and it's not like a dormant. The virus is known to cause very similar kind of disease even in other animals. So what it tells us is that this bovine coronavirus has got a very broad species specificity, and it can get into and cause harm to number of species of animals. And the reason we say that it is not dormant and it is it does cause a disease is if you want to find out if you have a virus or a bacteria which has just gone into another species and not doing anything, it somehow it has become the one of the milieu of the microbiome or the microflora, is to check for antibodies. If you see there are antibodies against any virus or any bacteria, that means it has caused the it has got some virulence for that species, and it has been able to instigate the immune response, and that's why you are seeing these antibodies. So the coronavirus, bovine coronavirus, is known to produce antibodies also in other species of animals. So which means that it has got a broad specificity for host. The BCB has also been isolated from dogs showing respiratory disease. So both enteric as well as respiratory forms have been shown. Similarly, there is a report from Rajasthan, which says Bikaner, which says that the bovine coronavirus is also jumped from cattle to the camelids. Right? So there were an outbreak very similar to cattle corona outbreak, and the isolation said that the isolation proved that it was in fact bovine coronavirus because of the similarities in the genotype. There is also a report that similar viruses have been isolated from human feces suffering from mild enteric disease. So we have to be very cautious saying that bovine coronavirus is not of zoonotic importance. It does infect children, it does infect others, and may cause mild infection. So taking care of bovine corona infection is extremely important from public health point of view. But we should remember that the current epidemic, what we call as COVID-19 epidemic, is not related with cattle. So it is not same virus which is the bovine coronavirus, which is coming from, which is there in cattle, and the and this virus which is causing COVID-19 is totally different. So there should not be any confusion. In the meantime, there were quite a few reports in the newspaper that this disease is coming from cattle, disease is coming from poultry. It's not like that. COVID-19 appears to be very specific to a particular host, human, and it's not causing much any infection. At least it's not reported up till now. Usually these viruses also keep on going to other hosts like bats and cats. So these are the what is called as mixing vessels, or the medial type of host in which there will be some multiplication, some changes would take place, and then it will come back to a mammalian host. And now the photograph which I have seen is of ant eating pangolin, and now it is believed that this COVID-19, which has this epidemic, is because of transmission of virus from pangolin to human, because this pangolin is a delicacy in China, and it is also eaten in Northeast. So there is a lot of smuggling going on from Indian pangolin smuggling from Northeast to China, and in China it fetches a good price. Now, while describing the species specificity and how it infects, it's very important for an epidemiologist or for a medicine person to understand how these viruses enter the cell and how the species specificity is defined. Now it is known that there are these viruses are known to recognize certain receptors on the cells. These are not the receptors which have been which are meant for viruses, because I don't think animal body will have a receptor saying that inviting viruses come and enter into my body. These are the receptors which are physiological nature, but somehow for purpose of binding, these viruses have developed domains which will be through which it will bind to those receptors. And once these binds to those receptors, there is a process called as endocytosis. because once they bind to receptor, there is a cascade of reactions which start happening. And now it is known that most of these cascade of reactions are because of the internal, cycle of signaling, signal which is dependent on either cyclic AMP or dependent on protein kinase C. So through that there is an invagination, and through invagination the virus particles will get inside, and then from there it will be getting attached to the genetic machinery, and from genetic machinery it will be multiplying, and after multiplication again there is a process through which there is an extravagination, where viruses from inside the cell will be coming outside. So say for example, in case of even for bovine coronavirus, also there is the virus has been crystallized, and since it's very complex, I'm not showing that to you, but they have recognized the domain, and those domains are most probably the carbohydrates. Those are the carbohydrate residues on the virus. So those are glycoproteins which are inserted into the virus particle, and these glycoproteins will attach and recognize. And that is the reason, and those are very complex glycoprotein which are attached. And therefore, through that, people have been able to discount that theory that this particular COVID virus was synthesized in the laboratory, because it's you may synthesize a nucleotide sequence, and then that nucleotide sequence can translate into a protein, but it's very difficult to insert those kind of complex carbohydrate onto the lipid membrane. So that is the basic difference, because of which it is believed that it was not synthesized in any laboratory. So the point here is the receptors should be present, and once the receptors are there, for example, we are saying that the disease is transmitted through aerosol. So once it is transmitted through aerosol, the virus particles will get inside the nasal cavity, and in the nasal cavity there are certain receptors which are already present. For example, in case of COVID-19, it is known that the receptors are the ACE inhibitors, ACE angiotensin converting enzyme. The receptor for angiotensin converting enzyme is the one which is recognized by this virus, and through which there is one more receptor which has also been isolated now, but precisely the how this binding takes place, that has also been worked out. Because if you understand how these are binding, and if you can develop a drug which can interfere in binding of the virus to the receptors, then you have a drug which will prohibit virus to get inside. The another strategy could be if somehow you can mask the receptor, and masking is done in such a way that the viruses are not able to go and bind to the specific receptor. So these are all very important areas of research interest to the drug developers. So in short, this is how. And since the ACE receptors are not very commonly prevalent in other species of animals, because the way blood pressure and is maintained is slightly different than in case of human. That is the reason you find that COVID-19 is very specific to human. It is not able to go to any other. And wherever you find these receptors, you'll find that will be the port of entry, and therefore receptors have been also found in the gastrointestinal tract. So there is a belief that COVID-19 virus could also get through GI tract, bind to those receptors and internalize. And then after internalization, you should remember that viruses cannot survive outside in the nascent form, and therefore you'll find very narrow viremia. I mean, the period is very narrow for viremic stage. As soon as it comes into blood, it has to immediately go and bind to the cell so that it can get inside the cell, and then inside the cell it remains protected for a very long period of time. So these are all the associated infections. For the first time, bovine corona infection was identified in 1973 in USA as an outbreak, and then from there on, large number of outbreaks have been reported, and in many countries now it has become endemic. Like there are farms where corona infection is quite endemic throughout the year. So you have a program of control of corona infections in young calves. So there are three forms. One is gastrointestinal form, hemorrhagic form, and the third is the respiratory form. The gastrointestinal form causes diarrhea and all related complications. When there is a diarrhea, then you have potassium loss, you have chloride loss, sodium loss, dehydration, hypovolemia, weakness, so all related syndrome, and you all are aware of that, so I will not go into detail. Hemorrhagic is very classical for these all the viruses. See why there is hemorrhagic syndrome is because of thrombopenia. And why thrombopenia occurs is because of two reasons. One is because of the immunological response of the viruses. What virus will do? The thrombocytes become the vehicle for transmission of the virus. So once they get inside the inside the blood blood circulation, they will bind to the thrombocyte, and this thrombocyte then bring about some conformational change in the thrombocyte. So this thrombocyte become foreign, and then the immune system starts recognizing them as foreign particle, and then they are broken down. So that's how there is thrombocytopenia, and then you have all those complications which we call DIC, disseminated intravascular coagulation. And you're seeing now lots of such messages on WhatsApp that coronavirus is not a virus. This is not because of virus, but because of a bacteria, and because this is causing clotting disorders, bleeding disorders, and death is not because of the virus, but because of this. So, but this is all interconnected. Another thing you're finding now in lots of people discussing about is there are also bacteria which is involved. Always remember that we when we talk of only one one virus and one disease, then probably we are shutting our eyes to a very common phenomenon which is called as a multifactor disease causal, where it's not only one factor, it may be combination of other factors, and out of that one factor could be an essential factor, like COVID-19 should be there. But once there is COVID-19, then you have other viruses getting triggered, other bacteria that are getting triggered, and then you have multiple of factors which are causing all these problems in the host. The disease is common in immunocompromised calves, and it may involve all the three forms together at the same time. So you may have a calf which is suffering from all the three types of syndrome. Also remember, coronavirus is common in young calves, and not in adult calves, because by the time they are no more simple stomach, by 6 months of time, most of the adults ruminants would acquire immunity against the virus, because it's really prevalent in the environment. So they'll get the virus and will also become immune to it. There are reports, because I've seen that there is one report from Canada way back in early 1980s, where they were working on shipping fever, and the biggest problem was whenever calves were brought into feedlots, they were finding that in the feedlot, a lot of these calves used to suffer from enteric infections and respiratory infections, and morbidity and mortality was quite high. Of course, morbidity is quite high, but because of morbidity, there are effects on weight gain and other things. And there it was found out that it's a mixture of bovine syncytial virus and the Pastula hemolytica, which nowadays is called Manihemia hemolytica. These were the one which are responsible for causing the disease. So the virus was the one which was responsible for bringing down the immunity, and by that time the toxins produced by these bacteria were causing problems in the pulmonary tissues, and then that's how the disease was happening. And interestingly, at that point of time, because I was with Wayne Martin in epidemiology department, and they were carrying out one investigation, and a very simple investigation told them that the disease is happening only when you are mixing adults and calves together. So whenever you have got a housing where the young ones are coming in close contact with adults, then because the calves are not sufficiently protected, they will get infection from adult and suffer from. So this is one of the lessons we should take, is in those farms where diarrhea like syndrome or respiratory syndrome in young calves is very common. Look at whether the calves and the adults are being housed together. If that is so, then that what we call social distancing we'll have to maintain, so that the infection from adults doesn't come to the young one. This is a multifactor disease. Now, as far as calves is concerned, morbidity is quite high, but mortality is very low. And morbidity is so high that in some farms you may have all calves that may be suffering from the disease. Now, diagnosis, there are various ways of diagnosis, and I'll take some about 5-7 minutes to describe, because I think there is a lot of confusion even in experts, leave aside the common people. Now, what generally we do is we are doing PCR test. Now, in PCR test, what we do is we identify the a specific gene sequence or nucleotide sequence or a part of the gene which is very specific to that virus, that is picked up as primer. And with that primer, you want to find out whether there is a virus in the body. So, and then you pick up the right material. For example, in COVID, they are collecting the nasal swab. And in the nasal swab, if they find there is a virus, then what they are saying is the person is having a disease, which is not true. Because what PCR does is PCR only identifies exposure and presence of virus in the person. That does not mean that the person is necessarily having a disease at the point of examination. It may be asymptomatic over there. It may or it may not develop a disease. It may have contacted the virus, but its innate immune system is so strong that it is able to overcome the viral load, and then it will develop immunity against it. So positive PCR should never be equated to presence of the disease. Now then, how to find out whether there is a presence of disease? Because here you'll have to also keep into consideration that there is also very likelihood that since there are large number of coronaviruses floating around in the environment, and even if by chance there is some homology with the PCR primer which you are using, then it's very likely that you are also detecting some virus which is there but not causing any harm. Number two, PCR should also not be done repeatedly, and that is what mistake many people are doing. That today I do it, and then after 7 days and after 14 days again I do, and then try to find out whether the whether virus still persistent or not persistent. There is large number of publications which have even in case of bovine coronavirus also there are reports that suppose you have done PCR in a patient once, it has come positive. Even if it has recovered, suppose it was showing symptoms, it has recovered, and if you take after 7 days or 10 days again the swab, it is very likely that you may get virus positive. It may be virus positive, or maybe because of the fragments of viruses which are now being excreted out from the body that you have been able to pick up. So it does not mean that the virus still persisting, or at least what people have shown is that a recovered person, even if he's showing PCR positive, is not able to transmit the infection. So in all probability, what is happening here is you are all after a person has recovered from corona, where you have first diagnosed corona positive by PCR, and then you have again finding that coronavirus is present, and as per your PCR, it means that it's passing now the fragments. Then to find out whether really there was a disease, you have to do what is called as the serological test. Now, as I have said earlier, what will happen if the virus is really virulent and infective? It will get into the inside the cell, multiply there. It will be picked up by the immunological system, and immunological system will produce antibodies against it, and antibodies will be circulating in blood. And if that you are able to identify, that means you have now identified that there is a virus, and that virus was virulent, and it has caused maybe very mild disease, but it has been able to instigate the immunological system, so you have antibodies that are positive. Another thing to remember here is whenever we are doing antibody testing, there are two types of kits available for ELISA or even for others. One is which related with IgM, and the second one is IgG. So you have to really decide, which test you would like to do, which kit you would like to use. Now, if I am interested in identifying whether the person is having a disease right now, I mean, there is an active disease, then I would go for IgM. If I want to find out whether the person has suffered from a disease and now is on the way to recover and is getting immunity or immune, then I'll go for IgG. These are two important things which you should remember. And what happens actually whenever there is infection, the first burst of antibodies are IgM, and then there is shifting of the antibodies, switching of the antibody, that is called as. So the IgM will switch to IgG, and this is an internal mechanism which is happening, and this internal mechanism happens because of the interleukins. So initially you have an infection, IgM is produced. Now body is also producing interleukins, and these interleukins are from the point of view of innate immunological system. This suggests that now body is trying to overcome. So now the active infection phase is over. So let's go for a long-term IgG. So there is a switching which I have shown here, and that switching takes place where the DNA segment is is chopped off, and then IgM becomes IgG, and then the B cells start secreting more of IgG rather than IgM. Now in epidemiology, epidemiological consultation for us here, the important part is number one, these are the young calves which are responsible, which are more susceptible. Adults are not susceptible. And then even if one calf is suffering, and if you have got a high density of calves housed together, then through cuffing and through feces, if the virus particles are there, and if there is contamination of grass and other things, then it is going to be spreading even to other animals. Bovine coronavirus is not secreted in milk, hence there is no chance of contacting bovine corona from milk. Okay, that is because I have told you bovine coronavirus has got a very, very limited viremic phase. So you don't get coronavirus into milk. So there is no way that it will be transmitted. So transmission would happen either because of contamination of feedstuff through dung, if the feces is secreting viruses, but mostly it is through the coughing and the particles, the respiratory particles which are being excreted out. Then another problem for you should remember as a preventive medicine person is virus shedding calves. So there are calves which will remain shedder for some time, even when they have suffered from a disease. And this has been a phenomenon which has been recognized long back. But now recent papers are suggesting that as far as coronavirus is concerned, once you have to more rely on symptoms. If calf has recovered from the respiratory syndrome or enteric syndrome, then in that case, even if you are picking up virus in the feces or in the expired particles, there is no chance that this calf will be passing infection. It may be the fragments of viruses or non-infective particles of the viruses which are being excreted in the environment. Now there is a definition of respirable particles. So there is a lot of work which are going on right now, and they are trying to decide what is the aerodynamics of the respiratory particles. When some person who is suffering from COVID has expired these particles, how long it remains. Now what are the aerodynamic models which are responsible? What should be the humidity, temperature? All those factors are being now worked out to find out whether the current social distancing we are talking about is normal, whether what we are talking about the contamination of surfaces, how long it remains on the surfaces. So these are all very important issues, I think, even for veterinary academicians to work on, because many times we just take something for granted that this must be happening, and in real life it may not happen. So this is also one of the exciting areas where the academicians, veterinary academicians, would be able to look at. Now there is also a lot of literature that is coming up, which is describing how the antibiotic and vaccines are also interfering in innate resistance. As I've told you earlier, the innate resistance is, because of number one, they say is, because of microbiome. That is a large number of different types of microbes and viruses which are present all over the skin, as well as in our tract, like respiratory tract, oral tract, vaginal tract, everywhere. You see there are large number of viruses, and because of now availability of high throughput isolation and identification of these bacteria, a lot of literature has come up, and the literature says that within 5 minutes of the infant born or the young one born from a very insulated and sterile uterine environment, when it comes to the farm or into this world, immediately large number of bacteria will cover it, and these are the bacteria which are the first army. They will take care of the infections that are coming in, so they are the first protector. So now there are a lot of literature that is coming up which says that whenever you are using antibiotics, you're using things like T-dip, germicidal, or you are using vaccines, you are also interfering in this microbiome. And this microbiome interference also leads to a lot of susceptibility of the population to new diseases. There is one very interesting paper I could read, and that was regarding vaccination with pneumococci. And they have found that if the if children are vaccinated against pneumococci, in microbiome you don't find pneumococci, but that place is taken by someone else. So there is also a replacement microbe that is available, so which is going to occupy that space which has been created. So it's a very tight walk where you have to consider that all your strategies should be able to strengthen the innate resistance and not to disturb that innate resistance which is very strong and given by the nature. This again just try to explain that around an infected calf will be able to shed infection only up to 5 to 10 days, and the period of shedding of the virus and the recovery from symptoms coincide extremely well. So there is no need for you to every time keep on doing virus isolation or PCR test. You can very well rely on the symptoms. You all know that there is no treatment available, but there is a strategy called PICE immunization. Bovine colostrum is known to be very rich in coronavirus antibodies, and therefore it is said that if you are able to feed colostrum to calf, they get good immunity against coronavirus. And here there are two things are important, because again here we always take for granted that colostrum is rich in antibodies. It may not be true. Colostrum may not be really rich in antibodies, so therefore you have to test whether your colostrum is of good quality or not. And there are such tests available. One of the tests which is which can be easily done like your CMT is glutaraldehyde test, where you take glutaraldehyde and add into colostrum and you get a gel formation. And with gel formation, you will be able to say whether your colostrum is of good quality as far as IgG is concerned. It's having more than 35 to 40 milligram per ml of antibodies, which is sufficient enough. That is number one. And number two point to be noted here is the first feeding to calf after birth must be colostrum only, not water also. Because now it is known that even if you're feeding water, there are receptors on the expressed in the gastrointestinal tract for this cholesterol antibodies. It's a very interesting phenomenon, which I have worked for 3-4 years. I have worked when I was in BBC. I used to know how this bovine IgG is getting absorbed through the gastrointestinal tract. How these are protected in the because even though there is trypsin, chymotrypsin, you have pepsin in the stomach, you have very high acidity there. Then you have trypsin, chymotrypsin. Then you have cathepsin D, which is there in the enteric enterocytes in lysosome. So the entire system is meant for destructing and digesting all these proteins. So how come for first 24 hours or 48 hours you have got a phenomenon where there is no digestion taking place, but the IgG is getting absorbed intact, and that is only once in lifetime. It happens only once in lifetime. Afterwards this this whole system is switched off. So it was a very interesting research which we have done to find out what exactly is happening, how these are recognized. So no, one of the important thing we found out was that these immunoglobulins in colostrum, that is IgG1, is directly coming from blood into the milk, and all these IgG1 are the one which against which the cow has been, whatever infections the cow or the mother has exposed to, those antibodies will be coming. So it may not be infection, it is just exposure. If a cow is exposed to certain antigens, it will be having that memory for those antigens, and before calving the antibodies will be secreted and will come into blood, and from blood it will directly come into udder and in the colostrum. So therefore, point number one is, if I get colostrum from New Zealand or from Australia, it may not be as good as colostrum which I am getting from my own farm, because if I get colostrum from my own farm, then that will be containing all antibodies to which the cows have been exposed to infections prevalent in the farm or in the village or in the district, in the state. So this you must remember that this is an important point to consider if you want to transfer passive immunity to the cow. Number two, feeding at one go as much colostrum as possible should be practiced. So, and you must feed it at least 2 to 3 times or 3 to 4 times in a day. Don't feed in one go a lot of colostrum, because it will cause some kind of problem. Number two, whenever you are feeding colostrum, feces will always be loose, so don't take it as diarrhea. The calf will be passing loose and mucus, diarrhea with mucus and other things up to 1 week. So you don't have to treat that with any antibiotic. You have to get alert only if feces of young calf is having blood. That is the indication that there is some pathology. Therefore, number one, colostrum should be the first feed to the calf. It should be fed 2 to 3 times, and I usually insist on feeding colostrum for at least 4 to 5 days. If not whole colostrum, at least some colostrum could also be mixed with milk, so that animals would be able to resist early infections. There is one more interesting article which I have read recently, and that says that colostrum is also very rich in rotavirus antibodies, but these rotavirus antibodies are not present in the first 3 days of colostrum. It is usually present after 6 to 7 or 8 days of colostrum, so it's slightly late. So that tells me that that milk of the cow is having antibodies not only for first 3 days, but it may span for longer period of time, and therefore feeding milk from the same mother for an extended period of time, for 14 to 21 days, is always better for the health of the dog. The second is immunization, passive immunization of cow. There is also in areas where you don't have enough of antibody titers in colostrum, there is also a process which is called as hyperimmunization of cows. So when cows are pregnant, at that point of time you can give this coronavirus vaccination. 2 or 3 vaccinations you can give, and in that case the colostrum which is secreted by this cow will be very rich in antibodies. So colostrum feeding is key to control. There is one Zoetis is having one corona vaccine available, but it's not only corona. It's a 4 different types of pathogens have been grouped together, and if you give this vaccination, then you have good antibodies which last for a very long period of time. And since the serotype is quite stable, the vaccine which is coming from USA could also be useful for our purpose. There is also one paper I found where a technician, while vaccinating, got self-injured with this corona vaccine, and he developed gangrene, and amputation was required. So you have to pass on this message to your technicians and your workers, that when you are doing any vaccination related with virus especially, they have to be very careful, because if there is self injection, it may cause problem. then this is how the social distancing takes place in case of calves. So you have all these calf housings which are separated like this, so that there is no cross infection from one to other. Now a little bit of herd immunity, and just let me check if I have time. Yeah, I think I'll finish this in 1 minute, and then we have 10 minutes to take questions. Now a lot of talk is going on about herd immunity, whereas herd immunity is very well known to vets. Probably this may be something new word for medicos. This is not a criticism, but we look at the medical colleges syllabus, and you find they are not really taught much about preventive medicine. They are more into glamorous clinical medicine. So generally, I have friends, who are medicals, since last 25-30 years, professors, who retired as professor of medicines, HOD medicine. Still, they don't know even basic things about, herd immunity, immunology, because these are very new things to them. So herd immunity means, where your population gets immune. So whenever you draw out a strategy of controlling a disease, there are two aspects to it. Number one, do you want to prevent the disease in individual animals or individual human? You want to prevent the outbreaks, or you want to stamp out the disease? These are two different, and these two different approaches, will require a whole lot of, different strategy. If you're vaccinating individuals, then individual will be getting infected. Will be getting protected. But as an individual, suppose if I am, in the environment where lot of individuals are not vaccinated, but I am vaccinated, then in that case, it is quite possible that even after vaccination, if I have a disease which is less severe, but I may be passing on, infections to other susceptibles. You won't come to a situation where the population has become immune. For a population has to become immune, you have to come to a situation where a lot of individuals are vaccinated. So you can see here all these oranges. These are all the one which are vaccinated. And when these are all vaccinated, you'll find they will become a kind of barrier, so that the infection is not passed on to the susceptible. So that's how you control epidemics. So remember, polio vaccination. Why polio vaccination is done on the same day, entire globe, same day, all children, susceptible children are protected. The reason is you want all the population, susceptible population, to be at the same stage of immunity. Otherwise, if I am doing FMD vaccination in February, then I am doing vaccination in other village in March, another village in May. It doesn't make any sense, because then you have population which is in variable immunological protective status, and there because the immunity also wanes, you will still have vaccinated animals or persons who will be susceptible to infection, and therefore you will not be able to control the outbreaks. For controlling the outbreak, you need to have what is called as herd immunity, and how much of the population should be protected will depend a lot on how the transmission is going to take place. Number one, and number two, how virulent is the organism, and number two, what is the immunological response. If you have got a virus or a bacteria which has got a good immunological response, and the response happens within 2 to 3 days, then probably you are going to get herd immunity, even if you are having 52 or 54% of the population to be covered with vaccination. If it is less and the window period is 14 to 21 days, you need a larger population. So 2 days back there is a paper which has come out which says that COVID-19, if you want to have herd immunity for COVID-19, then you need to protect at least 82% of the population, vaccinate. And if vaccination is not possible, 82% of the population should be exposed to some grade of infection, and then they will get immunity. So the current spread of the virus which are taking place, as an epidemiologist, in my opinion, is good as far as there are no diseased people which are coming to the hospital and there is no mortality. Spreading out the viruses in low dosage is good for exposure and development of the herd immunity. This is just a recent report, where BCV like virus was also reported in humans, so that I have already discussed earlier. So this is all I wanted to discuss with you today. If there are any questions, I'll be very pleased to take those questions. If because of time constraint we are not able to answer all the questions, please do share with the host, and I'll try to answer those questions, and our ISVM will be able to transmit all those replies into our Facebook page. Once again, and I'm very glad that after a long time I was able to address to you. Thank you.
Dr. Galdhar, it's all upon you. Kindly unmute your mic.
Hello, am I audible?
Yeah.
Hello.
You are audible, Dr. Galdhar.
Hello.
Please ask.
Hello. Hello.
Yeah, go ahead.
Yeah. Thank you very much, sir. So there is one question from Dr. Birendra Kumar Roy. He appreciated the presentation and whatever the things you have narrated about the coronavirus relation with angiotensin converting enzyme. Can you just again re-explain the things so that other newly joined participants can get the advantage of the explanation from you, sir? Please.
Okay, what I have tried to explain is that virus entry into the cell is dependent upon virus first binding to the cell receptors, and since these viruses have got predilection for specific cells and specific systems, therefore for binding of these viruses we need to have certain receptors, and those receptors are expressed on cell surface. So they are not actually receptors meant for viruses. They are receptors for something else. But somehow these viruses have developed a strategy to recognize those receptors. In case of COVID-19, they have found that there are ACE receptors, angiotensin converting enzyme receptors on the respiratory tract, and because then ACE angiotensin converting enzyme will be converting angiotensin into angiotensin 1, angiotensin 2, and that's how it exerts its effects on the kidneys as well as in the respiratory tract. So basically they are binding to those receptors. So therefore in whatever cells you have those receptors, the virus will be binding. So in case of COVID, it is ACE, but in case of other viruses, it could be different. So that is how the specificity of the host and the specificity of the cell is recognized by the viruses, and that is how they fool the immunological system to get inside the cell. So before there is any antibody response or defense response from the host, they bind to the cell, immediately get invaginated, get inside the cell. Once they are inside the cell, the immunoglobulins cannot go inside because immunoglobulin is of a very large protein molecule, so it won't be able to inside. So that becomes an insulated environment for viruses to multiply and then again come out, remain very briefly into the hematology stage, where they are in blood. So very, very narrow viremic state. Again, bind to the adjoining cells that are having those receptors. So that's how they keep on multiplying. So these ACE receptors are there in upper respiratory tract as well as in lower respiratory tract, and has also been found out in gastrointestinal tract. So these are the sites from where the virus would be able to get entry into the cell.
Thank you, sir. Sir, again, there is one question from some scientist. He is asking about the role of veterinary clinicians, especially our veterinary clinical medicine person, as a One Health constituents in this COVID pandemic, sir.
Okay. I think in COVID pandemic, what we can do is, we have to again, relook at the biosecurity which we people are following as far as animal is concerned. I think that concept of biosecurity should percolate into all the farms, into the hospitals and everywhere. Even the self-protection of vets, because I find that there are a lot of vets who are not bothered about their own self-security. They don't self-protect. They don't wear gloves. They will touch and come in contact with all kinds of exudates. So this is something which you have to be very careful about. Number two, I forgot to mention that there are quite a few reports which are suggesting that common cold which happens in human is actually preceded by bovine coronavirus infection in cattle, and that association now have been established that there is an outbreak of coronavirus infection in cattle, and that virus is now coming into human and causing common cold. So therefore, communication between the vets and the medicos is important. So in One Health, what is actually needed is a platform where the vets and the human can communicate with themselves automatically, because there is a now digital environment taking place. So if we have got a database of diseases that are happening in animals, then, and if that can be shared with the medical counterpart, or the diseases that are happening in the medical counterpart and can be communicated to it, that would become the first step of One Health connectivity between the two. Number two, in one of the seminars recently in Bombay Veterinary College on One Health, I had suggested one thing to the medicos, and that was whenever they are taking history, they don't have a column asking the patient whether he has got a pet in his house, whether he is a livestock farmer, is he dealing with cattle. So those questions should also become part of history taking, so that all those who are at high risk, and if symptoms are indicating that there is a probability of transfer from animal to human, that should be taken care of at that stage, and then that would be the initiating part of communication between the vets and the between the medicos and the vets. So extremely important part for the vet is somehow to develop a database of diseases. We don't have a database of diseases, and for having a database of disease, you need to diagnose the disease. So you need diagnostic facility, and after diagnostic facility, you need a database, and that database should communicate amongst all the veterinary colleges. So this, at one point of time, I had suggested this to Veterinary Council of India, that why not connect all the veterinary colleges, clinics onto one platform, where people, students will be able to share, case presentation. So if there is one area like Chennai and has got a good case in dogs, why it cannot be presented, to the entire country? Or a good, case in Ludhiana, a cow case, in Ludhiana, why it cannot be communicated to, so that is how we need to start communicating amongst ourselves first, and then communicate with the medical counterpart. So then, that One Health which we are talking about will come out of the seminar. Otherwise, that will become a topic of webinars and seminars, and we will forget, whatever we are discussing at that point of time, and nothing will happen on the ground.
Okay. Thank you, sir. Sir, at last, there are again 4 to 5 questions are there, sir. I will personally, it means ISVM, this page will contact with them, and whatever the questions are there, they will be communicated to you for its clarity, sir.
Thank you.
Sir, one last, it means a message we're requesting can be forwarded from your side. As sir, you are the stalwart in medicine. Can you explain what could be a role of our veterinarian in this pandemic in 4 to 5 points, sir?
Okay. Okay. See, there was a commission in USA long back in early 80s. There was a commission in USA, and they were asked to find out, what in case of medical emergencies, what should be done as far as human resource is concerned. And in that commission report very explicitly said that after medicos, any other person who has got a knowledge, about diseases, about pathology, about medicine, preventive medicine, drug, is the vet. And therefore, the recommendation was that vet should be directly, involved in such medical emergencies because of their experience in multi-species. That is number one. Number two. We should also look at the our own animal population, and then dispel all those misgivings that are coming up in the newspaper or in the WhatsApp, that disease is coming from here, this is coming from there. So all those things should be actively taken up. And in this case, the important thing is not individual. What I find difference between the USA and difference what we are doing is here the responses are mostly individual responses. If I, as a Dr. Samad, if I tell something, it doesn't carry much meaning. But if there is a notification from, say, ISVM, saying that disease cannot be transmitted, from one species of animal to human being, that carries lot of lot of weightage. So all our such professional bodies should become extremely active in such a situation, and should talk to the public in a very cautious way, but in a very scientific way, without any hesitation. We should talk to the public and tell them what is the truth. Then number 3 point we should take on is participation in R&D. Lots of science colleges are participating in COVID related development, and they are coming out in public that they are having such programs where they are trying to develop new drug formulation, new drug, nanotechnology, vaccines. So similarly, the vets should also start participating, become active in R&D, participate in funding applications like coming up from Bill Gates, etc., so that you can also start looking at. And since we all know that all these diseases, see, last 10 years, there is one paper which has come out which says that during last decade, whatever important epidemics that have happened in human, they have all come from animals. So therefore, the premonition of impending epidemic is going to come from vet. So it is the vet who should be able to first identify that there is a problem which is going to come up. There is a disease which we are diagnosing, which appears to be something different, and therefore we need to have a very aggressive diagnostic approach, which unfortunately I don't find. Our diagnosis is mostly dependent on symptoms because of several factors like lack of facilities, lack of mobilization, lack of collection of material, where to take, manpower. All these issues are there, but we cannot be defensive every time saying that we have got all these problems, unless and until we become active. Recently, University of Minnesota was awarded a very big grant, from Bill Gates Foundation as well as from CDC, Center for Disease Control, on surveillance and monitoring of such viral infections in animals, because that is the place where you will first monitor and find out if there is anything. It's like earthquake monitoring. So you want to monitor earthquake, and then alert people that there is going to be an earthquake, so that evacuations, other things can take place. So vet's role is like monitoring of all these issues. So therefore, we have to become very active.
Thank you, sir. Thank you, sir. Sir, one suggestion you are given about the different clinical case presentation. Okay, the one case which one is available at Chennai, case available at Gadwasu, Ludhiana, even though case available at different colleges. Okay. Yeah, so that suggestion we will take positively and come up with some program so that such type of wonderful discussion as far as the case presentations are concerned can be, it means entertained, and we can enrich with the diversified knowledge available at different colleges, sir.
But those cases should be the one where enough diagnostic workup has taken place, and therefore, you have a case which is really diagnosed positively and then presented. Not simple, some symptoms and I have treated this. I have got good results, so don't ask me any question how. But it should not happen.
Sir. Okay, sir. Okay. Yes, Dr. Nilesh. Dr. Nilesh.
Yes, sir.
Yeah, I'm doing a vote of thanks for Professor Samad.
Yeah, yes.
Okay. Sir, we are thankful to you for accepting our invitation and delivering wonderful lecture for our ISVM family and scientists involved during this presentation or participate in this presentation, sir. Thank you very much, sir. Thank you very much. Thank you, sir.
So this ends our presentation today. Thanks a lot from LUVAS, Lajpat Rai Veterinary University.
Deepak Balerao from USA, our colleague.
Pardon, sir?
Yes, sir.
I see.
Yes, sir. He is Dr. Deepak Balerao is there, sir. Yes, sir. He is there.
Yeah, very
Dr.
good.
Deepak Balerao. Nilesh, Dr. Deepak Balerao, please. Yeah. Yes. Yeah. Hey. Yeah.
Kindly unmute yourself. Dr. Deepak, please unmute yourself. Dr. Deepak,
please.
Please unmute yourself.
Unmute yourself.
You can do, as a host, you can unmute him.
As a host, Dr.
No, I'm not able to unmute him.
Okay.
Okay. I will send a message.
Yeah, okay.
Okay then, thank you.
Okay, sir. Thank you, sir. Thank you. I am also thankful to our president, Dr. D.S. Nauriyal, sir, and Dr. R. Ramprabhu, sir, for holding such wonderful webinar. Thank you very much. I again request all the participants to join with the ISVM webinar number 2, which one is going to be delivered by Dr. D.D. Kulkarni, sir, in evening. Thank you very much.
Okay, thank you.
Thank you, sir.
Thanks a lot to everyone from LUVAS, Lajpat Rai Veterinary and Animal Science University. And we will meet in the evening for the webinar 2 of ISVM. Thanks a lot.
Okay, sir. Thank you. Thank you.